The pandemic exacerbated problems for the NHS in Highland, as it did everywhere. But the region has a history of budgetary problems that required several taxpayer bailouts in recent years. It has a £1 billion health budget. It's now identified a need for savings of £42 million and is currently £8 million short of promised COVID funding.
We are obviously taking all of this very seriously. After a very volatile and difficult couple of years managing all the finances, but with a lot of extra money and a lot of extra requirements, we now need to find a way to pull that back in, and this is where we find ourselves at this point.
The Health Board cites a combination of inflation, pay rises and past pressures for its latest financial challenge. NHS Highland has had a problem with recruitment and retaining staff for many years, and still nobody's quite sure why that is. But in very tough economic times, it does present a bittersweet irony.
Our biggest challenge at the moment is recruitment, and so we have underspends in our staffing budgets as well, that if we were fully staffed in a regular way, that would reduce some of our locum and agency costs.
Watching closely are local leaders of the Doctors' Union, the British Medical Association. They're concerned that cost saving in hospitals has prioritised emergency cases to the degree that it's endangering those left on ever lengthening waiting lists.
I myself have had a number of patients this week who have been phoning me describing a deterioration in their clinical conditions whilst they await operations, and I'm thinking about people requiring spinal surgery, and I'm thinking about people needing orthopaedic surgery, and also people awaiting general surgery. So we do have patients whose conditions are already deteriorating.
Health chiefs say they're focused on a mission to recruit and have resolved to crack the mystery as to why they've struggled to attract people to the profession. Iain Ramage, STV News.